Thank you. So hi, everyone. So as she said, my name is Jackie Leit. You'll also see it written as Jaclyn. I'm a licensed clinical social worker. My background actually has been in community mental health or hospital-based mental health, which is really where I kind of developed my passion and my love for working with medical conditions. When my son Jared was diagnosed with KSS is kind of where I really made my shift, and I went into private practice at that point because it is so much easier to do my own schedule around, I don't know what, 10, 20 doctor appointments and even possibly 1 week. But really what I wanted to do today was kind of handle this really kind of from a practical level, because often we say to you guys, mental health, you need to see someone for mental health. You have to talk about mental health. Okay, what does mental health mean? Like, what does that actually mean? And then the other idea being, we're saying go to therapy, go get psychotherapy. Okay, well, thank you. Again, what does that mean? And where am I supposed to find that? Because unless you're at one of the children's clinics, chances are you do not have someone on staff that's actually going to be able to provide any kind of therapy. So I wanted to go with the CDC definition. And on this one, I'm going to read it so I get it right. Per the CDC, mental health includes emotional, psychological, and social well-being. It affects how we think, how we feel, and how we act. It also determines how we handle stress, relate to others, and make healthy choices. So basically, mental health kind of covers everything. It's kind of all encompassing. And there's a lot of stigma around mental health. So I think it's really important kind of how we think about it and kind of how we perceive it. The other part was, what is psychotherapy? So we're going to start with what it isn't. Hopefully the slides are. You didn't put my slides back in order. Okay, that's my son. Actually, that's my only son that will take a picture. That's Blizzard. Jared and Jeremy will not take pictures, but this is a legitimate conversation that I had with Jared. And he was just, again, it's a lot to deal with. And I said to him, I really think you should speak to a therapist. And his answer was, it's not going to fix the problem. I can't tell him it would. I told him, you're right. It can't fix the problem. So I think it comes down to then more, what can therapy do? And what therapy can do is help us learn the skills, help us shift our perspective, help us see things a little differently. And I'm just laughing, by the way, because I set my stopwatch to start and I didn't start it. Haha. I'm going to steal Brad's 5 minutes now. So the other piece in terms of the stigma, mental health and physical health are inseparable. This is a quote from Dr. Megan Bear. She's at Johns Hopkins. Her work was done with the multiple sclerosis population. Her research corroborated exactly what we would suspect. If you're dealing with a chronic, progressive medical condition, you are dealing with so many unique situations within your mental health. This isn't like just being told, oh, have reflux. Here, take a pill. You're good to go. This is ongoing. This is impacting all of our areas. So really considering the stigma behind this concept of mental health and trying to break through it within the concept of living with a chronic medical condition. Because honestly, the two are so intertwined. If you think about it, if you're under stress, your head hurts, maybe your stomach hurts, maybe your back hurts. The mind body is so connected, and often one can trigger the other. And even if one hasn't created it, it can exacerbate it. So really learning to manage the aspects of our mental health and how we're feeling and kind of how we're seeing things. No, it's not going to make things go away. But if we're in a better mood, if we're feeling better and more in control, maybe we have less fatigue that day. Maybe our body aches less that day. Maybe we'll eat a little bit more that day, just because we're feeling a little bit more control and a little bit more comfortable in our environment. So again, trying to look at that stigma. So I can't even counter, and I know some of you probably can't see it, I can't see it, but just trying to give an idea of all these different aspects that are hit when we get diagnosed with mito. Like every aspect of our world is hit. It hits financial, how are we going to pay for this? Can I keep working? It hits obviously our health, but all of these things. So one way I like to kind of combat that stigma, and you'll learn I like analogies. Think of a cup of water. It's an amazing cup. It could be a Stanley cup. It could be a China cup. It's an awesome cup. It's perfect. And now there is this universe that is pouring water into this cup. You are not in control of this water. and it's pouring into this cup. And the cup keeps getting water in it. And now you're watching it overflow. And you can't stop it. You're grabbing paper towels now. You're trying to move the cup. You're asking for someone to get you another cup. You are looking at the universe going, please stop. You're trying to find some way. Is it the cup's fault? No. We are the cup. There are so many things coming at us. So we know mental health becomes a huge issue when a person's resources are kind of tapped out, when we're overwhelmed. So it's not that there is something that we're doing wrong. And I think often with mental health, we're thinking that stigma, I'm mentally ill, I'm weak, I'm not doing something. No. How can we handle so many things at once? And it's okay to ask for help. That would be the paper towels. It's okay to ask someone to go and get another cup for you. That would be relying on a family member or a friend. The yelling at the universe to please stop the water. Well, I think we've all done that and been like, why? And that is okay too, because that's part of this as well. But really thinking that, no, we have done nothing wrong. We have not asked for any of this. And the idea is, okay, how do we manage that flow of water so we don't overflow with it as well? Some misconceptions about mental health. I hit a couple of them, but reasons why we do not want to go into mental health. So we said mental health therapy is for people with real mental health issues. And there are people who have things that are more biologically based. So schizophrenia, bipolar, even a more clinical depression, a more clinical anxiety. But that doesn't mean it's any different and doesn't need to be treated. Like if you break your leg, it doesn't matter how you broke your leg, you still need to get it treated. So while for some of us, our symptoms may be more transient, they may be more episodic, it's still a depression or an anxiety or a phobia. It may be considered an adjustment disorder, but they still need to be treated. I think the thing for people to think about is one, it may not need medication. It is usually more therapy oriented. And what I like to remind people, and I'll come up again, therapy doesn't have to be like, oh, you have to go every week. It can be, I can't go every week. I can come once a month. Okay, come once a month. That's better than not at all. So really can kind of challenge the idea, no, we're not mentally ill. We're stressed. We're overwhelmed. We have so much on our plates. I should be able to handle things on my own. I am strong. And I know, and I'll shout out to Megan right now because we were both saying before, love when people say, oh my gosh, you're so strong. How do you handle all that? I'm not strong. I have no choice. I have to do this. But I also have learned, when do I need to rely on my friend Megan or Faye? When do I need to turn to these people? That's being strong. Asking for help is being strong. Therapy is too expensive or not easily accessible. I do have some handouts, and if I don't hit them, because again, don't want to go over Brad, I have a list of resources, but the reality is therapy used to be really hard to find. COVID did one good thing. It really brought telemental health more to the forefront. So it is really easy to access therapists. I will say one challenge is the laws haven't kind of caught up. So you can find a therapist who's like awesome and actually has experience with Mito, which there really aren't that many of us, but we exist. So those of you in New Jersey, hi, or Florida, I can treat you if you're in Florida. But a therapist will know whether or not they are licensed and able to work within your state. But most of the organizations, APA, Psychological Association, NASW for social work, all the professional organizations are lobbying to try to shift those licensing laws so that there can be reciprocity over state lines. So that again, if you have a rare condition, you can find somebody who can treat it versus, okay, I'm going to find someone who kind of has an idea and maybe has some basis. But again, it's easier sometimes if you don't have to explain from the start. In terms of the expense, I really advise, if you can, to stay within your insurance plans. Contact your insurance company, get a list of names. There is a myth that good therapists do not take insurance. I will take personal offense at that because I believe in insurance. I need insurance. My child needs to go. I need to go. So you can find really amazing therapists that do take insurance. You can also find therapists that do take sliding scale. One resource that you'll see at the end that I want to bring up, because I know sometimes, especially if you're Medicaid, it can be challenging to find a therapist. And if you go out of Medicaid in many states, you could actually risk losing your Medicaid. So you don't want to go out of it. But there's something called Open Path Collective. And these are therapists who have actually agreed to work either for pro bono or for very low sums. So you would just go online, you would type in what you need, and they would match you with a therapist. So again, very affordable. So really trying to make therapy much more affordable and accessible. Mental health professionals just listen to people vent, and I can do that with my family and friends. You can, but your family and friends may judge you and they may have an opinion and they're emotionally invested. While I won't say don't get invested in the people that I work with, um, I'm not judging you. I am not here to tell you what I think is right or wrong. I can't. My job is to help you think for yourselves and how to empower you and how to focus on your strengths. So our friends and family can be really supportive. They're not neutral. The other thing I often hear from people is, I feel like I've gone to them so many times, I don't want to keep burdening them. Again, this is somebody who is there, who can listen. And ideally, a therapist, it's not one size fits all, and most therapists do work from several modalities. So they can kind of also shift with you for where you're at. If you're more emotional one day, they can do more emotion related work. If you really want to focus on skills based that day, they can kind of shift with you as well. So again, family and friends are so important within this, but not neutral. Mental health professionals focus on topics that don't relate to my issues. So I kind of touched upon that. I know a lot of times when I'm working with people who are coming into me for their medical, they're like, are you going to ask me about my childhood? I'm going to kind of because I need it for my intake paperwork. But after that, no, why are you here? What do you want to work on? Most people don't realize that when you see a therapist, you determine your treatment goals. We don't determine it. You actually have to technically sign off on this. So I could say, I want you going out and swinging on a trapeze, but if you don't want to swing on a trapeze, you're not swinging on a trapeze. What do you want to work on in therapy? And tell the therapist that. But most people don't realize that. I already see so many medical professionals. I don't want another one. Totally get it because in my family, we call it the ologists, and we're up to like 10 ologists. And no, don't really want to add another. But again, that accessibility piece, you could do this like at 10 at night. You can do this online. Virtual therapy has been proven to be just as effective as in-person therapy. There are some symptoms that a good therapist will say to you, I don't really feel comfortable doing this virtually. Something like if someone has a really severe depression and they are expressing any suicidal thoughts. But most therapies can be done truly very well virtually. So again, you could do this at 6 in the morning. Most of the people I see lunchtime. I see people at 9 o'clock at night because people are working. They have lives. So again, kind of challenging some of these ideas that we have. Okay, and you can't see that one. This is a quote from my younger son. So I have two boys. My younger son is not affected. And I said to him too, because why not? I'm a therapist. You should see a therapist. His answer to me was, I'm not the one with Mito. I shouldn't be able to complain. Okay, good point. But no, he has every right to have his feelings. I'm going to go to another analogy. So imagine you're in a car. Someone's a driver. Someone's in the front passenger seat. Someone's in the back passenger seat. If any one of you have someone in a trunk, we're really going to need to talk about that later. I'll see you during Q&A. But assuming no one's in a trunk, we're all in a car. But every perspective is different. If you look outside the window from your side, you're seeing something really different, but you're all in the same car. Our affected loved ones are in that car with us. They need just as much support and help as we do. Whether we're affected, whether we're with the loved ones, whether we're a caregiver, we all have our journey on this, and no one's journey should be dismissed. So siblings, family members, anyone who's involved, again, that same idea and challenging that stigma. No, there's nothing wrong with you, and if you need to get support, as I'm saying, support from a mental health professional, it's a lot to process. And often we see with siblings and loved ones that idea of, I don't have a right to be upset. This isn't about me. This is about my child or my loved one. It's about all of us. And if we're not okay, we can't help anybody else either. Oop, I'm hitting the button when I shouldn't be. Okay. So now we've kind of talked a little bit about what mental health is and challenging that stigma of it. Okay. So types of mental health providers. So one thing that I've noticed throughout kind of the sessions this past couple of days was they kept saying psychologists. Psychologists are wonderful and they are a valid, I think you're psychologist, a valid form of therapist, but they're not the only type of mental health professional. And I think as we keep saying psychologist, then that's what people are thinking I need to find as a psychologist. And there are four main types really that you can go to if you're looking for a private practice practitioner. Clinical psychologists probably have the most education. They have doctorate levels, so they're either usually PhD or PsyD. The unique thing with psychologists is that they can do clinical testing. So if you needed psychological evaluations or educational testing, they can do that. But a lot of their education is more research-based. A PsyD is a little bit more clinical focused, but again, they are spending more time on doing research. They've written a dissertation, so you've got a little bit of a different academic approach. Clinical social workers. Clinical social workers, which is what I am, so I will own my bias. We earn a master's in social work. A social work degree is not necessarily a clinical degree. We're often trained in case management, in advocacy, in policy, in helping to connect people to resources, serving underserved populations. So clinical is only a small part of our education. So for a social worker to become a psychotherapist, we actually have to take about 3 years of supervision hours. We take extra training and extra courses in order to be able to perform psychotherapy. What I find unique for this population is sometimes a clinical social worker is a great fit for someone with a medical condition because we have that background. We've often worked in a hospital. We've often done discharge planning. We're often aware of some of those resources. So again, even though we're in a psychotherapist role, we can't turn that hat off of ourselves either. So we're able to kind of provide that as well. A licensed professional counselor, they have a master's usually in psychology, counseling, or related degree. Their focus is actually very clinical. So for about 2 years, that is really what they're focusing on. Art therapists and other type of creative therapists will often get an LPC. They'll do a master's in counseling so that they can also provide psychotherapy along with what other type of like art therapy or movement therapy they're doing. Marital and family therapists. They also have a master's in counseling or related degree, but their focus is very much more on marital and family. But again, any of these four types can provide incredible therapy. So it really is who is accessible to you, whose style do you like, who do you feel you might click with, who do you feel you might connect with, but not to get caught in that idea that it's just psychologists. Thank you for that wonderful lead into my next slide. I didn't plant him. But that is a really great question because no, none of those people can prescribe medications. If you do need medications, you will need it prescribed by a medical professional. So it's either an MD, a DO, a nurse practitioner, but someone who can prescribe. So we're usually talking about psychiatrists, child or adolescent psychiatrists, neuropsychologist, or a psychiatric nurse practitioner. I will totally own there is a shortage of those. There's a shortage of those to start with. Now imagine trying to find someone who actually is comfortable to work with Mito. That is not an easy task, but they're out there. Often they, I will admit, often they are harder to find within insurance plans, but they do exist. If you feel like medication is an issue, and if you're seeing a therapist, they will tell you. They'll be honest with you if they feel like your symptoms really aren't going to be really fully covered through doing therapeutic processes. There is one resource I want to throw out there because, again, it is very hard to find a psychiatrist. There is a new online platform. It is called Talkiatry, and I actually have had patients who have used it. It is a way to connect to psychiatrists. So again, it will be usually within your state or where they are licensed. But if you live in North Jersey and there's a psychiatrist down in South Jersey who can actually see you, they can connect you. And again, it's going to be virtual, which for a lot of us makes it easier because again, who wants to get in our car and travel to another doctor appointment? I do kind of want to explain because probably all of you seen all those letters like after all of our names and what do those mean? So really quickly, just using mine. So the MSW, those first few letters are the degree. The next would be our licensing. That's usually started with like an L, except for PhDs and PsyDs. They just stick with the PhD and the PsyD part. But that next part, so licensed clinical social worker. Now, all those little extra letters, there's a lot of certifications that are now being done. A lot of insurance companies want to know that if you're saying you're an expert in an area, are you really an expert in that area? And if you choose to take these extra trainings, which you're doing intensive trainings, you're taking a large exam, that's what those other initials are showing you. So mine says that I am board certified in telemental health. I started telemental health way before COVID started because working with a chronic medical population, a lot of my people just, they're not getting in the car. They couldn't drive. At one point, I couldn't find a building that had an elevator. I had people who couldn't come upstairs. So I chose at that point that telemental health would be a really good thing for me. I've chosen to also get a certificate in grief. Again, because I work within the medical population and grief is such a huge aspect of what we are dealing with. So there are a lot of therapy modalities. It is not one size fits all. Some therapists will also be, I am cognitive behavioral. So that's all they do. Very rigid, which is fine. And it works for people. It is a wonderful form of therapy, very evidence-based. What I find within the medical population, one size fits all doesn't work well for us. And some of these more strictly evidence-based, more rigid therapies may not be the best for us. So ideally, you want to find someone who may use a different bunch of modalities. As social workers, we tend to be trained as what we call generalists. So we were kind of taught kind of a whole bunch of them so we can kind of a jack of all but not an expert in any. Then we pursue to become experts in some. So basically these are the main 4 types of therapy that you're going to hear, and I'm going to kind of fly through it a little bit, but this is where some people have some of those issues. Some therapies are very talk oriented, psychodynamic, humanistic. That is very talk oriented, and that's also often where you're going to get the therapist, you know, where you see on TV when you're like, I think I'm upset about that. And they go, why do you think that? That would be more psychodynamic and humanistic. Versus if you say to a therapist who is more CBT or behavioral, why I am upset, they're going to say, okay, let's talk about it. What were you thinking about before you got upset? They're not going to be kind of playing off that, They're going to actually engage and be a little bit more directive with you. So the 2 therapies that I find really work best within the medical community is a combination of combining grief therapy, so grief process, along with something that's called acceptance and commitment therapy. And I like these 2 because they really play off of each other well. Having a chronic medical condition really is a grief process, and it's an ongoing process. It's not a process that ends. I think most of us know, we think we've handled one diagnosis, and then we get hit with another problem. And now we're back in that cycle. So keeping in mind, there's not a beginning or an end to it, but having the skills to handle that process. The interesting thing with the 5 stages of grief, they were not created around death. Dr. Kubler-Ross created these 5 stages of grief when she was working with a hospice population. She saw these 5 stages of grief in people who were dealing with a chronic medical condition. What are we dealing with? Chronic medical condition. And those 5 stages are not linear. They don't go in a line. And I think that's where a lot of people also get confused. You don't have to hit every stage at once. You don't have to hit it in order. You may bounce back and forth. There is no rhyme or reason to this. It's just that we know to expect that these stages are natural. All those feelings that are going to be kind of covered within there, they're real and they're valid, which goes to that next stage, acceptance. Oh, wait, I want to jump down to the 6th stage. David Kessler was a protege of Dr. Kubler-Ross. He lost a son to a terminal disease. He created what he called a 6th stage, which is making meaning. So finding ways to kind of move forward, to not get stuck. So even going past that acceptance, but more kind of into that question of what now? What do I do with that? And again, it doesn't mean doing anything like, again, he did something amazing. He created a new stage of grief. But for most of it just may be, okay, I'm going to resume going back into my daily activities. Or maybe I'm going to choose to be an ambassador for the UMDF and I'm going to talk with other people. It can be whatever it is going to be for you. Acceptance is an important stage, and that ties into actually ACT, acceptance and commitment therapy, acceptance being in the name. Why I think this is really important is because that's a huge piece, I think, of what we are living with. Acceptance doesn't mean you like it. People think that acceptance means I'm happy about this, I'm good with it, I'm okay with it. No, acceptance means, okay, this is the reality, now what? What do I do? We can't change Mito. I wish we could. We can't change our symptoms. We can't change. We don't have predictability over the progression. Some things we radically have to accept because they're not in our control. Doesn't mean we like it. But then the question is, now what? And that's what I really like about acceptance and commitment therapy, because it allows for it. Where cognitive behavioral therapy often will kind of get you to suppress or challenge or change what they call negative or irrational beliefs. In our community, a lot of these beliefs are not irrational. If my son looks at me and says, you know, I'm worried I'm going to go completely blind, or even I'm worried I'm going to die, I can't tell him he's wrong. I can't tell him, oh, that's irrational. Stop thinking that way. It's an accurate statement. So what a therapist would do is help him. So validate and acknowledge that statement, but in acceptance and commitment therapy, don't get stuck in that thought. How do we move forward? So I told you I like analogies. This one, I'm going to go with a riptide. Because most of us in a situation, we panic. You give us bad news, you put us in a situation. Human nature is I'm going to struggle, I'm going to fight, I want to survive. But what if surviving is adaptability? What if surviving is knowing, okay, I've got to kind of go with the flow, which is literally the riptide. If you're caught in a riptide, your instinct is going to be, I'm going to fight, I'm going to struggle, I'm going to swim. If you're in a riptide, you actually want to go with the riptide. You don't fight it. You go with it, you swim with it, and you're going to be okay. So the idea is really embracing some of these things, because sometimes the things that we fight the most against are the things that will actually give us some of our independence back, some of these things that we feel like we lost. So I'll use my son again. When he was told he had to get hearing aids, he fought me tooth and nail. Don't even ask what happened with the pacemaker. He can hear now, and he's happy he can hear. He can hear his anime. He can actually hear in his classes. It's a really good thing. But we had like 4 months of fighting. Once he embraced something that really just felt so horrible, again, it gave him back his freedom and his independence. It helped his mood. It helped him become social again. All these things that we often feel we lose, less isolated. So again, that idea, acceptance doesn't mean we like it. But okay, what else? What do I do? What now? What's next? Couple of other modalities just to mention. Those of us with kids, play therapy is obviously a great modality. Someone who is not verbal, someone who is more cognitive delayed, again, play therapy can be really wonderful for them, as well as art therapy. Going to kind of hit to hypnosis for a second, because hypnosis is one of the things that I was actually trained in for pain management, which is not common, but I know some of you do have pain. You can actually look a little creatively at some of these therapists and look to see how they use some of these different skills. Biofeedback can be great for someone who is experiencing dysautonomia. It can help them learn to regulate their heart rates a little bit better. Because I know for my son, his heart rate can go all over, his temperature can go all over. So sometimes looking at some of these other modalities can help. Want to remind you guys about support groups. And remember, support groups are often not run by a mental health professional. So it tends to be more support and counseling. A therapy group will be run by a mental health professional usually, but they often tend to be more time limited and maybe a little bit more skills focused. Really want to encourage also the creative art therapists, art therapy, movement therapy. All of those have such validity within this. And then family therapy, again, because we're all along for that ride. Yep. EMDR is working with kind of the neuroplasticity of the brain. So it really is looking, they do bilateral movement. Really what it works well for is someone who's had a traumatic experience. And thank you for asking. I put it up there because, again, I think for a lot of us, we have had traumatic experiences, but the idea behind EMDR or other things like, now I'm blanking, that's so bad. Brain help. I'll come up with it when I'm done speaking. But the idea is we rewire. So that traumatic memory that brings up all those emotions through EMDR, the idea is that you can't go down that neural pathway anymore, and that traumatic experience then has less trauma. And again, for a lot of us, I mean, I know a muscle biopsy, if any of you have experienced, for a lot of people have been really traumatic experiences, especially as adults. I know some of you have done it awake. Like at least my son was asleep for his muscle biopsy. I can't imagine being awake for a muscle biopsy. That's got to be horrible. So EMDR is really useful on a traumatic experience. Okay, I've gone through some of these and I know I'm running out of time, but I really do want to kind of point out top two, ask direct questions to your therapist. Don't be afraid to. People are afraid to. What are their modalities? What are their hours? Are you ADA accessible? Do you give homework? If you give homework, is it going to be in a format that if you have a visual impairment, you're going to be able to see? What are their after hours policies? Ask those questions and don't be afraid to ask. And if you don't like the therapy when you've started with them, tell them. If it doesn't work for you, this isn't, like I said, one size fits all. A therapist may try something that works, but I know for me, if I try to use breathing techniques with someone with anxiety, which I used to try to do, they end up hyperventilating. It works for some, but it's not going to work for all. You have to communicate if something isn't feeling like a good fit for you. I really want to emphasize when you're looking for a therapist and those resources, which you may actually have to look at in the handouts, look for therapists who say in their backgrounds that they have training with medical conditions, caregivers, grief, loss, trauma-focused, trauma-informed, and ACT. You will usually then get a therapist who can really, truly address the issues that we need addressed in this population. Again, you're not really going to find a lot of therapists who've worked with Mito. It's worth asking, but if they haven't, ask them if they're willing to be educated. If they say no, clearly walk out the door. If they say yes, awesome. And then it's direct them to Mito U, direct them to your doctor. But again, a lot of therapists will be open and will want to learn in order to be able to help. We've already discussed you decide the treatment. We've already discussed most of those. Okay, these are the resources. So kind of really quickly. So BetterHelp is an online platform. Probably a lot of you have heard about it. What I do like about it for this population in particular is they will allow for asynchronous forms, which means it could be a phone call, it could be texting, it could be email, which insurance companies will not usually cover. But through BetterHelp, they actually will cover those, and they will connect you to a therapist and give them kind of what you're looking for. Discuss that one. Good Therapy is basically a directory of therapy providers. We talked about Open Path. Therapist.com and Psychology Today are also, those are two of the bigger providers directories. You type in what you're looking for, it will come up with all of their information. Really want to highlight Find Empathy for a second, because that was one that I kind of stumbled upon. I know I'm over. That was created by Dr. Megan Baird. That was the quote that we looked at earlier. She created this platform in recognition that there are not therapists. We don't know who these therapists are that actually work with medical conditions. So it is a very small platform right now, but therapists are going on it and actually listing what medical conditions they work with. So if you go into it, please don't type Mito. I tried that. It doesn't come up. But if you type visual impairment, if you type GI, if you type some of the symptoms, you will come up with therapists who are actually trained and want to work within that population. And I think I already said contact your insurance companies, talk to your doctors, reach out to UMDF or Mito Action if you need resources. Those are some of my references. And thank you guys so much for being here and sitting with us today. And that is my contact information if you would like to get a hold of me.